Glaucoma is a very important disease, still the second leading cause of blindness worldwide. So it's important that we detect it early because many studies have shown us that when we detect the disease earlier, the visual prognosis is better. We're able to hopefully arrest it or reduce the chance of progression to much worse visual morbidity. Lots of progress has been made in imaging modalities in detecting early changes in retinal nerve fiber layer, both peripapillary and also in the ganglion cell complex around the macula. More and more with greater tools, with greater sensitivity, we're actually able to pick up disease at an earlier stage and better monitor its progression, both with OCT and also with perimetry. The Hood report allows us to look at the whole structure of the peripapillary nerve fiber layer and also the ganglion cell complex and the ganglion cell layer in the foveal region. And it puts it as a composite in a large superpixel composite, the 9 or 12 mm zone, where we're actually able to see the entire area. So the Hood report incorporates the peripapillary nerve fiber layer report, the macular ganglion cell complex layer report in one report. On top of that, it predicts where one might detect defects on the 24-2 field, any defects in the 10-2 report, in the central field report. And it overlays it as a composite. It flips the image such that when a doctor looks at the report, he's able to see with the color coding where the retinal nerve fiber layer defect might be, where the ganglion cell defect might be, and the next few reports actually show where this might cause a perimetric change. It is useful specifically in patients for whom we might be performing screening. They don't want to do the onerous visual field test. I will show the patient the report. I'll tell them, this is your nerve. I'm comparing it against people of your age group. And the thinner areas are in red color. The normal areas are bluish greenish. Then I did a larger scan that tells me that this defect corresponds also in the middle of your eye, which is a very important part of your vision. The next few pictures here tell us that there are some areas might have early visual field changes. I would like to follow this up with a visual field test to see whether those areas are affected in your eye. They actually do understand their disease better and they would like to know more about it, and every time we do a scan, we are on the same page. The Hood report is an added layer, which I don't feel is crucial in my practice for myself, but I find it as a useful adjunct, especially in the people who are not as experienced so much in handling OCT. It allows us to detect or predict where defects might be in the visual field. It adds about 2 to 3 more minutes, but with regards to learning curve, it's pretty easy to understand because it's very graphically represented and it's flipped where the defects might be. So that's an added thing that the Hood report adds that some other devices don't have as of yet. In fact, I would highly recommend using it as a nice adjunctive tool in helping you detect glaucoma, manage it, and work with your patient to manage it better.